All right, good morning, everyone. I'm hearing my clock dinging outside saying it's 9 a.m. So while others are hopping on, we will go ahead and get started this morning. Thank you so much for joining us today. My name is Christine Minnick, and I'm the Child Welfare Program Specialist here with the Virginia Department of Medical Assistance Services, also known as DMAS, and I'll be helping guide us through today's session. We're really excited to welcome DSS staff, stakeholders, and caregivers from across the state for this important webinar focused on the new foster care specialty plan coming to our state's Medicaid program for youth and foster care, adoption assistance, and former foster care. So today's session is part of a larger ongoing effort to improve the way our systems work together to serve children and families. There's a growing recognition both at the federal and state level of the need to invest in coordinated, trauma-informed, and prevention-focused care. And the Medicaid changes we'll talk about today reflect that shift. We want to make sure you understand what's coming, why it's happening, and how it may affect the children and families you serve and care for every day. So before we dive into the content, I'd like to quickly go over today's agenda and a few housekeeping notes for the session. We'll start with a quick overview of Medicaid and managed care, and then move into the upcoming changes with the implementation of Anthem's new foster care specialty plan. From there, we'll share details about the transition this summer and then hand it over to our partners with Anthem to introduce their robust and passionate foster care specialty plan team and review key support resources, and then we'll end with some FAQs. So a few reminders about today's format. Attendee microphones and cameras, as well as the general chat functions, are off to help minimize distractions. However, you can submit questions at any time using the Q&A function. And we'll address common questions we've received either through the registrations or other webinars, and we'll address those during our FAQ portion. And finally, a recording and resource links will be shared after the webinar. So with that, we'll move to our first section and get started. So just briefly, Medicaid was created along with Medicare under the Social Security Amendments of 1965. It covers over 70 million individuals and 1 in 4 Virginians, which is more than any other health insurance program, and a large majority of the children and families you all work with. The Department of Medical Assistance Services is the state agency that administers the Medicaid programs in Virginia and provides oversight of Medicaid policy and benefits for all members. Virginia Medicaid provides high-quality health care coverage, disability services, and long-term services and supports to eligible individuals and offers both full benefit and limited benefit programs. Eligibility for Medicaid is based on many factors, such as age, disability status, income, and for certain groups, resources. And the mission of DMAS is to improve the health and well-being of Virginians through access to high-quality healthcare coverage. Medicaid is funded and administered jointly by the federal government and states. So we have federal oversight and policy from CMS, or the Centers for Medicare and Medicaid Services. And in Virginia, we have 2 delivery systems to administer Medicaid benefits. We have fee-for-service, where Medicaid benefits are administered directly by DMAS through contracted providers. And then this is commonly referred to as straight Medicaid, or FFS. And if members are in fee-for-service, they're either new to Medicaid and waiting on that first MCO enrollment cycle, or they're in a group that's excluded from managed care, such as those on limited benefits plans, or placed in a psychiatric residential treatment facility, also excludes members from managed care enrollment. So managed care, on the other hand, is a service delivery model where contracted private health plans or managed care organizations coordinate care to ensure member needs are met. And we'll be focusing our presentation primarily on our managed care delivery system, which serves over 87% of Medicaid members and an even higher percentage of foster care, former foster care, and adoption assistance members, which we'll see shortly. So there's a lot of benefits to managed care delivery system, a main one being the care management and coordination of all healthcare services for the member. And also all Medicaid MCOs operating in Virginia are required to cover services within at least equal amount, duration, and scope as Medicaid, in addition to providing additional enhanced benefits and linkages to resources to address social determinants of health. So what is Cardinal Care? You may see Cardinal Care used interchangeably with Virginia Medicaid, and Cardinal Care is our Medicaid program name that includes all members served through both our fee-for-service and managed care delivery systems. And then Cardinal Care Managed Care, or CCMC, is Virginia's Medicaid's managed care program, more specifically. So we're going to do a couple of quick and easy history lessons here on the next couple slides, and this will help give context to the why when we discuss the development of the foster care specialty plan. So DMAS made this rebrand to Cardinal Care for all Medicaid programs originally in January of 2023. And by October of 2023, we had received the federal authority to combine our two separate managed care programs and contracts. Those previous programs, as some of you may remember, were called Medallion and CCC Plus, and they were merged into one single managed care contract to serve members more consistently and without interruption in care among our MCOs. So at that time, we also released a request for proposals, or RFP, to reprocure the statewide contracts with up to 5 managed care health plans that members could choose from. And in that RFP, we also included an addendum for a single statewide, foster care specialty plan, where one of the selected health plans would also be selected to provide Medicaid coverage for all youth in foster care, adoption assistance, and former foster care. So that brings us to our next history lesson, which is more specific to the improvements in Medicaid coverage for these particular members. So as some of you may know, Virginia is one of the few states where the Medicaid agency does the eligibility policy, and the Child Welfare or Social Services Agency does the Medicaid eligibility determinations. So because of that, we have a long history working in partnership, not only to enroll and serve all Medicaid members, but particularly to address the needs of members involved in the child welfare system, to whom both of our agencies have a responsibility. So going back to the Medicaid service delivery systems we discussed between fee-for-service and managed care, states historically served individuals with special healthcare needs through fee-for-service systems due to the complexity and number of specialty services required. However, in the last decade or so, as states have become better at operating managed care models, many have transitioned individuals with special healthcare needs to managed care to better coordinate care, improve healthcare quality, and at the same time control costs. So in Virginia, thanks to a partnership between DSS and DMAS, over 10,000 youth in foster care and adoption assistance transitioned successfully from fee-for-service to managed care statewide between 2013 and 2014. And this all started a few years prior with a pilot transition with Richmond City DSS. So we worked with Richmond DSS to move 300 youth into managed care in 2011, before transitioning the rest of the state. And fast forward to now, 42 states plus Washington, D.C. provide some or all care for Medicaid members, including children in foster care, through some form of managed care. And while most states use standard managed care programs, almost a third, 14 plus D.C., enroll all or some youth in foster care in what are referred to as specialized managed care programs. And these specialized managed care programs are designed to exclusively serve either youth in foster care or similar specialty populations, such as those with chronic or complex conditions. And that leads us right into our next slide, where we want to touch on the planning and development of Virginia's foster care specialty plan before getting into the details of the transition. So some of you might be asking, why now? As you can see from our efforts in the last decade plus from that last slide, DMAS has long recognized the unique needs of children and young adults impacted by the child welfare system. So on the timeline in the last slide, we saw that the research and planning around the idea of a foster care specialty plan began almost 3 years ago in 2022, just after the launch of the governor's Safe and Sound Task Force, and shortly followed by the Right Help Right Now behavioral health transformation. As many of you know, the objective of the Safe and Sound Task Force is to work collaboratively with local and state agencies serving youth in foster care to address the barriers related to safe and appropriate placements, while the Right Help Right Now initiative was directly related to improving Virginia's behavioral health system. So DMAS's involvement in both of those statewide initiatives, as well as the interest and support from the Office of the Secretary of Health and Human Resources and the Virginia Department of Social Services, along with over a year of research and planning, led to DMAS including in the RFP for one selected health plan to be awarded the single statewide foster care specialty plan contract addendum. So we have been able to work with DSS through each step of this process, from planning to implementation, including having DSS representation on the evaluation team for the foster care specialty plan selection, as well as an ongoing implementation work group to continue incorporating DSS and stakeholder input. And we wanted to be sure on this slide to include an example and resource for those interested in learning more specifically about the benefits of specialty health plans for youth in foster care. Texas was kind of the first to do it, to implement a Medicaid managed care program specifically for children in foster care. And their Medicaid program, which is called Star Health, contracts with a managed care plan called Superior Health to coordinate the health care of children in foster care and former foster care up to age 21 in their state. So as you can see from some examples on this slide, Superior has demonstrated continued high performance for children and youth in their program, and they also drive innovation and improvements across the entire Star Health Texas Medicaid program with their foster care program. So there's a few highlights on this slide of some of their outcomes in the first years of implementation. And then we also have a list here of some other states who have implemented these specialty managed care plans over the last several years. Our state and North Carolina are the most recent to implement. I believe North Carolina's is aiming for December of 2025. So there's links here that will be shared after the presentation for more information on this. And now we want to talk about eligibility for Virginia's foster care specialty plan. And this slide is an important one because it will be the answer to several FAQs we've received about who's covered under this plan. So Medicaid's eligibility manual, also linked on this slide, is kept up to date on the DMAS website and is dictated by state and federal policy, which defines who's covered by Medicaid and in what aid category they're eligible. So we just want to share that this is not changing. There won't be any changes to Medicaid eligibility parameters or definitions, and there won't be any reduction in Medicaid services or coverage through this foster care specialty plan. So these three groups of individuals enrolled by their local DSS office in these three aid categories are the only members being impacted by and served by Anthem that we're discussing today. So all children in foster care are categorically eligible for Medicaid unless they're not considered Virginia residents, or in rare cases, if non-4E, if they have income or financial resources that make them ineligible for Medicaid. So that's foster care aid category 076. And then children with special needs can be eligible for Medicaid coverage to facilitate adoptive placements and ensure permanency for youth. And this coverage is coordinated through the local Department of Social Services according to the Adoption Assistance Agreement. And that's Adoption Assistance Aid Category 072. And then finally, under the Affordable Care Act, young people in foster care who turn 18 and age out of the system are eligible for Medicaid up to age 26. So for Virginia, if an individual was in foster care in any state upon turning 18, they can be covered through age 26. No financial eligibility requirements for this group. So we'll come back to these three populations, but this is a snapshot of kind of the definition and the three different aid categories that we're looking at today. And then here's a look at where Virginia is today. So as of May 1st, from this data, you can see we had about 16,500 youth enrolled in Medicaid in these three eligibility categories. The pie chart shows the membership distribution currently among our health plans, and you can see that only about 3% of these members are in fee-for-service. You can also see the list here of our 5 current health plans, and you'll note that this list of MCOs reflects the currently contracted MCOs through 6/30/25, which includes Molina Complete Care, But then beginning 7/1, Humana Healthy Horizons will be a new contracted health plan in Virginia, and Molina will no longer be available. And that's a result of our reprocurement as well. So let's get into some details in the next few slides. And the details here can get a little confusing with 2 transition phases that we're doing this in and slightly different regions of the state between DSS regions and DMAS regions. So the official transition of all members to Anthem is going to begin on July 1st. All members in the Tidewater and Central Cardinal Care Medicaid regions will transition at this time. And also because Molina will no longer be available as a Medicaid MCO in Virginia, all eligible Molina members will also transition to Anthem 7/1 as well. The rest of the state, meaning Charlottesville, Northern Virginia, Roanoke, and Southwest Virginia Cardinal Care regions, minus those that were enrolled in Molina, will transition to Anthem on 8/1. So we want to pause here to, excuse me, to make an important note about another frequently asked question. So the transition schedule, as listed here, is based on the member's address as determined by the information entered into VA CMS, which is the local DSS system that transfers over to the Medicaid system. In VA CMS, the member address is also referred to as the client address. This information is not entered the same way around the state for youth and foster care. Some localities use the agency address for the member address, and some use the member's placement address. So I encourage each individual locality to check VA CMS or check with your benefits worker on the case to determine what address your agency has for your members or clients on their Medicaid case in VA CMS, because it's the member address that determines which region the member is in. And so we'll go into some details on the next few slides about the regions and mailings that we're sending out to members. But if you do have any confusion around what your locality's member address is, then please feel free to reach out to fostercare@dmas.virginia.gov, and we'll share that email address later because we can help individually since localities are all doing it differently. So we'll have a written out list of the localities on the next few slides, but this map just gives you a snapshot of the Cardinal Care regions and a visual of your locality. And so flyers for phase 1 members were actually mailed to adoption and former foster care phase 1 members this past week. So, or last week really, kind of, I think in phases. So they should be arriving. And they were also emailed to DSS last week for phase 1 members, and then, or phase 1 localities. And then phase 2 members will be receiving flyers in July before their Anthem assignment. And one thing to note, again, is that adoption assistants and former foster care members have these flyers mailed to them, while foster care workers have received or will receive electronic copies of this flyer. And that was to avoid mailing multiple copies of the same flyer to every worker for every youth on their caseload. So we're doing those for foster care members electronically. And then after Anthem has officially been assigned for the member that's transitioning, another letter will go out, and this time via mail for all 3 member groups with additional information. So all that to say, this isn't the only chance you or others will have to learn about the change before it happens. And I'll pause on this slide to just let everyone make a note about their locality's transition date. Members currently enrolled with Molina, regardless of where they live in the state, and then those with member addresses in the localities listed will be transitioning on July 1. The localities with asterisks are the ones that aren't in line with others in their DSS region for this transition. So for example, you can see Fredericksburg, King George, Spotsylvania, and Stafford are in the DSS Northern region, but are transitioning in the first phase with Central. And Mecklenburg is in the DSS Piedmont region. So their transition regions will go against the norm of the rest of the state, of the rest of their fellow DSS region localities. And again, these slides will be shared after, so if you need another look, you'll have a chance. And here's the second transition region locality listing. So you can make a note if you see your locality listed here that members in these regions will transition August 1st unless they were enrolled with Molina. The localities transitioning August 1st generally line up with the DSS, Piedmont, Northern, and Western regions, besides Buckingham and Fluvanna, which are in Cardinal Care's Charlottesville region, out of line with their DSS Central region. And this brings me to just the slide where we want to reiterate the importance of our partnership with DSS as legal guardians of our foster care members and also as the partner agency to conduct Medicaid eligibility for our members. It's important that all information is accurate and up to date in order to ensure both a smooth initial transition and also ongoing support from DMAS and Anthem. So as we've discussed for Medicaid, aid categories are an essential piece of information to identify who members are and what category of eligibility they fall into. And because you can only have one aid category, if a member is eligible in more than one aid category, there's typically a hierarchy determined by policy guidance. And one important clarification we want to point out today is that these three foster care aid categories we've been discussing are, according to Virginia Medicaid's eligibility manual, the top of the hierarchy and should always be used if youth are eligible for them, even if they're eligible in other aid categories. So one common one we see and one discrepancy that we're working to correct between our agencies is that members who have a disability and who receive SSI are sometimes categorized into that aid category, which is 051. Instead of a foster care aid category. So DMAS wants to ensure DSS benefits staff are aware that all youth in foster care, regardless of 4E status or SSI eligibility, should be enrolled in the foster care AC 076 eligibility category, and same with adoption assistance and former foster care enrollments. So after the first webinar we hosted last week, we actually heard from some localities that the VA CMS system hierarchy still does identify 051 first for the aid category over foster care aid categories. And we have heard from our policy, our enrollment policy and eligibility policy division that members need to be overridden at this point to ensure enrollment in AC 076, 072, or 070 as appropriate. So if you have questions about that, which many folks have had questions about that because it is new guidance to some, please feel free to reach out. We've taken initial steps in working with DSS to update the 4E manual to reflect this policy and minimize further confusion about this. But we just want to clarify on this slide that we're only able to determine foster care status in our system by the 3 aid categories defined previously, and that's the only way to be enrolled in this foster care specialty plan. All right, so wrapping up before handing it over to Anthem, on this slide, I have another visual of the foster care specialty plan transition timeline as we start to wrap up with some details specific to members and their guardians. So I'm going to use my pointer on this slide to take us through this journey on. Here we are at the beginning of the timeline where we've encouraged phase 1 localities to attend a webinar ahead of the first transition date of 7/1. On June 19th, in just a few days, the Medicaid system will automatically assign Anthem's foster care specialty plan to members enrolled in Molina and in the localities discussed for phase 1. The system change will also generate a letter to the guardian with information about enrollment into Anthem's foster care specialty plan, how to contact, and how to opt out. On July 1st, by then you'll have, and Anthem will share about this more, but by then you'll have your Anthem cards, and these members will wake up enrolled with Anthem for phase 1. And we'll do the same thing all over again in July with these members, with the webinars offered, letters going out to guardians on the 19th, and enrollment for all phase 2 members on August 1st. And some final details. Another frequently asked question we've received, which Anthem will also be able to share more about, is continuity of care for members transitioning. Will we have lapse in services or coverage? What about open service authorizations, et cetera? So DMAS has a continuity of care requirement in our contract, indicating that when members enroll in a new health plan, the new health plan must allow you to continue to see your current providers for up to 30 days, even if your provider is not in the new plan's provider network. Your new health plan may also extend this time frame if needed to ensure you can continue to access care. And additionally, all service plan authorizations must be honored within this transition time as well. We want to take a moment here to provide information about the opt-out process. While we know our DSS partners are on board and invested in participating in this plan, our hope is that today's presentation offers helpful context and clarity about the many benefits of this new plan so that caregivers and members will also feel confident and supported in participating as well. So after the initial transition, members enrolled in the foster care specialty plan will be able to request to opt out of Anthem. And similar to the current MCO change process, these requests can be made at any time in the year. There's no open enrollment or lock-in for selections. And also all requests, like now, will still be directed toward the enrollment broker, also known as the managed care helpline, with their contacts listed on this slide as well. And aside from urgent case-by-case situations, opt-out requests made on or before the 18th of the month will be effective the 1st of the upcoming month, while requests made after the 18th of the month are effective the 1st of the month following the upcoming month. And that's true for pretty much any enrollment or eligibility change made through Medicaid. So specifically for foster care members in aid category 076, like we mentioned previously, because of the support and investment by the governor, the Office of the Secretary of Health and Human Resources, and our partner agency in this process, DSS, DMAS has designed the program especially for youth in Virginia involved in the child welfare system. Therefore, youth in foster care who do opt out of the foster care specialty plan will only otherwise receive services through the fee-for-service system and will no longer be enrolled in managed care. Similar to current MCO change requests, only local DSS foster care workers listed as such or as the authorized representative, again in VACMS, are able to make these requests for foster care members. Also, because the DSS workers have to verify their identity, they're only able to make these requests by calling the managed care helpline rather than going online or through the app like other members. So members in adoption assistance and former foster care who request to opt out of the foster care specialty plan will be able to remain in managed care and will have to select a different available MCO. And same as the current process, adoptive parents can make these requests for adoption assistance members. Their names have to be on the case. And former foster care members are able to make these requests themselves. And requests, like I said, requests to opt out or change MCOs for these members can be made by calling the helpline or going through the Cardinal Care app or the website. And this is our last slide before handing it off to Anthem, and it just gives a quick recap of what is changing and what is staying the same. So Anthem's foster care specialty plan will cover all eligible members in aid category 076, 072, and 070 statewide. All members will be automatically enrolled into the foster care specialty plan with no action required. After the initial transition, members will have the choice to opt out of Anthem. And then what's staying the same, there's going to be no reduction in Medicaid services or coverage. Medicaid eligibility will not be changing for these members. It's still one managed care program, Cardinal Care Managed Care, and the same contract with all 5 Medicaid MCOs, while Anthem has the foster care specialty plan contract addendum with additional requirements for supporting these members. And then another thing staying the same is newly enrolled Medicaid members will still be in fee-for-service for a short time before enrollment into a health plan. So similar to the timeline that I mentioned earlier, members newly enrolled in Medicaid before the 18th of the month will be enrolled in managed care the 1st of the upcoming month, while members newly enrolled in Medicaid after the 18th of the month will not be enrolled into managed care until the 1st of the month following the upcoming month. So now I'll hand it over to Susan Perez, the Program Director of the Foster Care Specialty Plan with Anthem Health Keepers Plus, to introduce her team and her program. So welcome, Susan, and I'll let you take it away.
Thank you, Christine. Good morning, everyone. I'm Susan Perez, and I'm the Foster Care Program Director here at Anthem. And I'm joined today by my colleague, Maria Richardson, our Program Manager. Just waiting for our slides to load, and we go to the agenda, Maria. And I'll pause here for just a moment. This is what we're going to cover today, and we will get these slides sent out to everyone after the presentation. And we can go to our next slide. So our first two slides that we have for you highlight our Anthem leadership team and the resources that we have dedicated to the success of our specialty plan teams. And I'll start by introducing our Virginia Medicaid Plan President, Erin Lambert, on the top left. Erin has a huge heart for foster care and has supported foster care implementations in other states as well. And then, of course, our leader is Director of Foster Care, Shanice Gangadine. Some of you have had the pleasure to hear her speak previously. She's a registered nurse with extensive experience leading teams serving youth with complex needs, and she also has lived experience in foster care. We are really lucky to have a dedicated foster care medical director in Dr. Charlene Brown. She is double board certified as a psychiatrist specializing in pediatric and adolescent psychiatry. And then I'm joined today by Maria Richardson, our program manager. Maria brings 15 years of experience developing foster care programs across our organization. She started her career with Maryland Department of Social Services and also has lived experience as a foster parent. On the bottom there, you can see our regional care managers. So they lead our teams providing care management, and they are aligned with the 5 regions of DSS. And some of you joining from local DSS hopefully have had the pleasure of meeting some of these folks, and they all bring a ton of experience in child welfare. This slide represents our specialty teams. So we actually have 2 entire teams dedicated to specialty clinical roles that support care management. These teams are led by 2 of our senior managers, one leading our community supports team and one leading our specialty supports team. And we'll talk a little bit about all of these roles on a future slide when we're talking more about programs. But I want to call out Claudia Balcarcel on the bottom right. She is the manager of our transportation team and also will be the leader of our foster care specialty plan support line. This is a picture of our ever-growing team at a recent Comfort Cases event. That day, we packed more than 200 backpacks for youth newly coming into foster care. It's a really great day. I hope maybe some of you on the call were able to join us that day. Next slide. At Anthem, we believe that every child deserves a chance to thrive. And as a community, we have the power to make that happen, and we share that responsibility. By working together, we can create a supportive environment where every child feels embraced by their community and build a brighter future for all of Virginia's youth connected to foster care. Next slide. So most of you on the call, I'm sure, are familiar with our role as a payer. That's how most people know Anthem. But today we really want to shed some light on the ways we can partner with you all to care for the youth we serve. And our goal is to collaborate to create a more cohesive and comprehensive system of care. This slide really highlights how Anthem and Department of Social Services can complement each other in the shared goal of safety, permanency, and well-being for the youth that we serve. And over on the right, you can see some of the complementary forms of support that we offer. Those include things like health assessments, care planning, navigating healthcare, and crisis support. So we want to share some of the unique features of our foster care specialty plan with you all today. One of the things we do is provide regionally based care management for all members in foster care, former foster care, and adoption assistance. And as we mentioned earlier, that's aligned with the DSS regions. Each member and their caregivers will have a dedicated care manager to help navigate the healthcare system and access resources that address their health-related social needs. We also have a trauma-informed care management model that is truly designed to meet the unique support needs of youth, foster parents, kinship, and adoptive families. We'll be using data-informed decision-making tools to ensure members' physical, behavioral health, pharmacy, and social needs are met. And then our program provides extensive enhanced supports for transition planning. We want to empower youth who are aging out to confidently self-manage their healthcare and health-related social needs. Our primary care managers will be a single point of contact for comprehensive coordination of all member needs. And we'll also have a dedicated foster care specialty plan support line team, and that team can provide additional non-clinical support and resources. Over there on the right, these represent some of our specialty roles. This, I think, is one of truly the most unique things about our program. Not only do we have dedicated care managers supporting all of our members, but we have two entire teams of specialty roles providing specialty supports. So the kind of things that they can help with, we have transition of care managers who can support discharges, level of care changes, transition age youth liaisons, an education and employment specialist. We have clinical roles to provide post-adoption support and support with family preservation. We have a dedicated judicial liaison, a program analyst, and also a safe and sound specialist. And all of these unique roles are experts in the resources that children, youth, and caregivers need to maintain permanency and reduce caregiver burnout. We also have innovative programs coming in the future, including partnering with Centers for Evidence-Based Partnerships in Virginia to expand training of clinicians in evidence-based therapies. And our goal is to expand access to therapeutic interventions that provide effective mental health care for the unique needs of the youth we serve. We also have toolkits for caregivers, including foster, adoptive, and kinship families, and programs that increase social, emotional learning for all ages, as well as peer support opportunities for parents. So we're committed to supporting our local DSS in navigating healthcare and addressing the needs of youth in our care. Our team is here to provide guidance, resources, and assistance to ensure you have everything necessary on our end to effectively support the children and families you serve. So some of our immediate priorities in the first 30 days of enrollment, we will immediately assign a care manager based on region, try and establish contact with Department of Social Services and the foster family, and assess any immediate needs. Our care managers are also trained to focus on ensuring that youth have access to pharmacy, medical, and behavioral health needs in those initial days with us. They can assist you with locating providers, coordinating visits, and managing transportation needs. And because many of our members have experienced some degree of trauma and have a wide range of behavioral health needs, we also want to reassure everyone on the call that our care managers on our foster care specialty plan team, they have a strong collaboration with Anthem's behavioral health team, and they're trained to support you and can help assist you in connecting youth with behavioral health services. So some of those youth behavioral services they can help with things like intensive in-home, referrals for ABA, therapeutic day treatment, MST, FFT, or brief strategic family therapy. Our behavioral health team also has a dedicated peer family specialist who has lived experience and can provide support to any foster care member and their family age 26 and under. And that peer support specialist, they provide assistance to members and their families in navigating substance use or behavioral health care services. Our care managers are also available to attend FAP meetings whenever possible, and we'd love to connect with additional localities and support other FAP teams. Next slide. You go one back, Marie. Oh no, that's the right one. So we get asked a lot, what are value-added benefits? Which is a great question. These are benefits above and beyond the core Medicaid benefits. And our members in our foster care specialty plan have access to a really wide array of value-added benefits. And these have been carefully tailored and chosen for their unique needs and to support overall well-being. And so there are so many benefits, we cannot get them all on 2 slides. So when we go live, we will provide a comprehensive list of those benefits, but we want to call out several of our favorites today. So I know the Chromebook benefit is one that is very popular. That will continue to be available. Members 17 and older can receive a Chromebook after completing a health risk assessment. We can also consider that benefit for youth under the age of 17 when it's not available through their school system with the support of their care manager. We have an educational milestone program where we offer gift cards to youth who achieve a GPA of 2.5 or higher during a semester in the school year. And we also offer gift cards for online enrichment classes for things like nutrition, cooking, and fitness related courses. One of the benefits we're really excited about, we recognize that we want to provide an opportunity for foster and adoptive families to make memories with each other. So we have a family game night, and members between 5 and 18 can choose between a movie night package with a restaurant and movie gift card, or they can do a restaurant gift card, a board game, puzzle, and dice. We also offer gift cards for clothing annually for our members that can be used at a variety of retailers of their choice. And we have GED support for our members 18 and older, and they can receive up to 4 vouchers for the GED test that can cover all 4 subjects. So these are some additional value-added benefits that are available to all of our Anthem members and will also be available to our foster care specialty plan members in addition to the ones that are unique to the specialty plan. So some that may be of interest for youth, they can receive books, grocery gift cards. We have a benefit that'll give a gift card for eligible youth to purchase sensory items. We have resources for youth club memberships or summer camp, sports physicals, and more. We also have vouchers, not only that can be used for the GED, but could also be used for other application fees for post-secondary education or tests. And we offer for age 18 and up a free cell phone with a preloaded suite of digital health apps. And we also have 24-hour access to physicians for urgent care needs from a computer, tablet, or smartphone. We have a robust transportation benefit. All medically necessary transportation is covered, and we also offer value-added benefits each quarter for members, and they can use those additional trips for things like going to the grocery store, food bank, job interviews, place of worship, or visiting a government office. We also have some additional benefits, including gift cards that can be used toward personal and feminine hygiene products, home delivered meals after hospitalization, home safety items, and financial support with obtaining a state-issued ID. And There are so many benefits. These are just some of our favorites. So we look forward to getting more information to you all because we're excited about the benefits and want people to be able to take advantage of them. These are some important contacts for the foster care specialty plan. We do have a dedicated support line for the specialty plan. That's that first number on the screen. We ask that you not try and use it until July 1. It is not live yet, so it will go live with the specialty plan. The second number is our Anthem transportation vendor. And then the third number is our national call center, our customer service line. And we know there are some folks on the call who probably would like provider contacts as well. So number 2 is our national call center provider line. And number 3 there is our Anthem provider website. Those are going to be our 2 best resources for providers, but we also recognize that sometimes providers may need to reach us about a specific member, and they want to be able to link with the care manager for the member that they are supporting. So if that is the case, we can provide that foster care specialty plan support line. So in some of our presentations in the past, we've been asked this really great question: why foster care specialty plan? So as we close, we want to share some of our whys with you all. By streamlining our collaboration efforts with Department of Social Services and providers and DMAS, we hope to make our processes more efficient and effective for everyone involved. The foster care specialty plan will also provide consistent access to programs that are specifically tailored to meet the unique needs of the population we serve. Our goal is also to provide better outcomes by providing one-stop accountability and a single point for data collection. By optimizing our resources under a dedicated foster care specialty plan, we also can better ensure that our resources are used efficiently and effectively. And with a dedicated, specialized approach, we hope to improve permanency and stability for the youth that we serve. So in closing, we really want to invite you all to collaborate and partner with us. We want to identify the ways that we can provide the best support possible to our local Department of Social Services. And we really want to figure out how we can communicate and work together like puzzle pieces fitting in to achieve success. And some of you may have already had a presentation somewhat similar to this. Our team is busy trying to get out there and visit all of the local DSS that we can, and we really look forward to working with all of you. Thank you, and I will turn it back over to you, Christine.
Awesome. Thank you so much, Susan. And I'm going to share my screen again to take us to our frequently asked questions slide as we wrap up today. We want to take a minute to walk through some of the most frequently asked questions we've received about this new plan. And these questions on this slide reflect some common themes, and we hope talking through some of the answers will provide some helpful clarity going into these next couple months. And I see we're also getting some questions in our Q&A. So after we talk through this slide, we'll take a look at those and see what we haven't covered yet. So I'll go through this first column here and cover a few things, and then we'll kind of go back and forth. So I'll hand it over to Anthem to touch on a few of them as well once I get through the first few here. So regarding different services or populations and whether they will be impacted, hopefully our presentation clarified some of this, but for number 1, there are no costs or copays associated with Medicaid coverage for these members, and that won't be changing. Foster care specialty plan, for number 2, foster care specialty plan implementation will not change or reduce Medicaid coverage, services, and benefits. As you've heard, Anthem's foster care specialty plan has value-added benefits above and beyond Medicaid covered services, but no reduction in services. So number 3, only members, like we said, it feels like I said it a lot, but it is helpful to remember when you're wondering about certain population groups. So only members enrolled in aid categories for foster care, adoption, and former foster care will be covered by and impacted by this upcoming implementation. So foster care specialty plan implementation won't impact Medicaid coverage of members in detention. Managed care enrollment is suspended while individuals are incarcerated at this time. Regarding out-of-state services, your Anthem care manager will be able to help navigate individual situations for members needing out-of-state services. But in general, when a move out of state is permanent, the youth would obtain Medicaid coverage in a new state by working with the DSS ICPC office. And if the Medicaid placement out of state is temporary, then Anthem does ensure that children in foster care, former foster care, or adoption assistants who are eligible for Virginia Medicaid receive medically necessary services, even if temporarily placed out of state. The out-of-state provider has to agree to Virginia Medicaid rates. And additionally, because there are no changes to Medicaid coverage or DMAS residential treatment policy in this implementation, there will be no impact on coverage for children placed in residential treatment out of state at this time. So we've also been asked if this plan will cover undocumented children and families. So at this time, foster care specialty plan implementation is not impacting or changing Medicaid policy around coverage for undocumented youth and families. Full information around non-citizen eligibility requirements can be found in the Medicaid eligibility manual on our website in Chapter 2, and the eligibility manual is linked on one of these slides. Similarly, we've been asked if this plan covers homeless members, particularly young adults, even if they were not formerly in foster care, and unfortunately, it does not at this time, as the enrollment is determined by the Medicaid aid category. For number 4, foster care specialty plan implementation will not impact TFC authorizations. TFC case management, service authorizations, and billing will remain the same. Youth placed with a TFC agency will transition to Anthem for coverage of all other Medicaid services aside from that TFC case management authorization, which is done through our fee-for-service service authorization vendor, Essentra. Number 5, similarly, this isn't going to impact the IACT process or residential treatment services at this time. The IACT process is staying with Essentra, and youth placed in PRTF will continue to be excluded from managed care while placed in PRTF or psychiatric residential treatment facility. This may be changing in the future, and we'll be sharing that, but it's not part of this implementation. For number 6, again, no changes or reductions in Medicaid covered services and benefits. So Medicaid's behavioral health services will not be impacted at this time. And then finally, before handing it off to Anthem to pick up with some of these last few questions on this column, I will touch on dental coverage. And again, this will not impact coverage of dental services. Dental services remain carved out of managed care and continue to be handled by DentaQuest. So while things like TFC case management are handled by Essentra, we've got dental services handled by our contractor DentaQuest. And then braces was another specific question, and those will continue to be covered as approved for members under 21. So Anthem, did you want to pick up from here and address a few of these other questions on the slide, and then I can pick back up at the end here?
Sure. So we know that everyone has concerns about current service authorizations or payments from other MCOs. We want to reassure everyone on the call that we don't want service to be interrupted for the youth who are transitioning to Anthem. So we will have standard continuity of care in place, and our care managers will be, looking at services that members are receiving and working with you to ensure that services can continue without interruption. Transportation to visits. I know we talked about that a little bit earlier. All medically necessary transportation for our members, of course, would be covered in the foster care specialty plan, just as it would be for our other members. We also have some, transportation value added benefits above and beyond covering the medically necessary transportation. For vision coverage, I think we've been asked about annual exams before. I believe with the standard Medicaid coverages, one exam every 2 years, but all of our members under 21 would be falling under EPSDT. So certainly if there's a clinical need or a medically necessary reason that a member would need exams or treatment more frequently, that would be reviewed under EPSDT. And Christine, do you want me to cover the how do I also?
Yeah, if you wouldn't mind
that, sure.
chatting about how do I can touch on number 5.
Yes. If you are looking for a list of providers, we have a website link that we can send out to search providers. We also have our foster care specialty plan support line. Our non-clinical staff can help with looking for providers. And sometimes we might have more complex provider needs, and that would be a good time to connect with the care manager who can also help with that. Once we assign a care manager, a letter will typically go out saying who the care manager is, but we recognize that letter may not always find its way to the right person. So you can also call the foster care specialty line number to find out who a care manager is. That specialty support line is also going to be the best way to request Anthem assistance with anything. And let's see, prescription issues. You also can use that foster care specialty plan support line. If there are any issues, we can link you with our pharmacy team, and the care manager can also assist with that.
Awesome. And then, yeah, I can just pick up, and I think that we covered how to keep your current health plan when we talked about the opt-out process for former foster care and adoption assistance members. Once Anthem is assigned, you can, adoptive parents or former foster care members themselves can request to opt out and choose a different MCO, while foster care members, after they are assigned to Anthem, will be able to opt out just to fee for service. And then in terms of when will we get our new MCO cards, Susan, correct me if I'm wrong, but I have heard Anthem say that they get sent out within a week after receiving the member information, which is going to be sometime at the end of this week, probably, when you receive the information for the 7-1 enrollment. So I think folks are worried that they won't get their new card in time, but you all typically get them to members before their actual enrollment date, correct?
Yes. And I would add to that, though, if anyone is in a situation where you don't have the card yet and you need the card for an office, just call us, call our support line, or if it's after hours, you could still call our National Customer Service Center a little bit later, and we can connect you with a card or try and help you get a digital copy.
Awesome. And then some folks were asking, for new members that come into care after this transition period, or even in the middle of this transition period, when will Anthem enrollment begin? And so hopefully we covered that kind of in chatting through the timeline of everything, but essentially when a new member, a completely new Medicaid member comes into care before the 18th, Anthem will be assigned the first of the following month. If it's after the 18th, it'll be first of the month following the upcoming month. And it's similar if it's a member coming into foster care who's already enrolled in a managed care organization. As soon as that DSS office changes the eligibility in the DSS system and it gets over to DMAS, if it's before the 18th, Anthem, it'll be switched to Anthem. by the 1st of the upcoming month. So it's really a similar rhythm on the 18th of every month. Anyone who has a change in MCO or a new assignment will get assigned. So hopefully that helps clarify the timeline questions. And now I think we will go ahead and take a look at some of the questions that have come in through the Q&A. And it looks like some of them are more for DMAS from the beginning of the presentation. So I'll look through and try and tackle some of those while Anthem, you can start taking a look and see if there's any Anthem specific ones. So I did get some questions asking if individuals 076, so foster care members, opt out to fee-for-service, will they be managed by Essentra or another arm in DMAS? That's a good question. So like I mentioned, Essentra handles service authorizations for most fee-for-service programs. So that excludes a few things like we've talked about, the dental that's carved out, there's pharmacy that's carved out, transportation that's carved out, but in general, service authorizations for fee-for-service service system programs are handled by Essentra. There won't be any care management provided for members who opt out to fee-for-service. So it's really just the authorizations and the billing that would be handled directly by Essentra or DMAS or another contractor in the fee-for-service system. We got another question that said that is related to the hierarchy of eligibility if a youth in foster care or adoption assistance meets another covered group. So like we discussed, if they're not enrolled in one of the 3 aid categories we've been talking about today, 076, 072, or 070, and they do qualify, but they also qualify in another covered group, then the local office should override the other covered group, typically 051, and assign that member to the foster care aid category. Automatic enrollment will not happen into Anthem until the member is in that foster care aid category. So I think I got a couple questions about that. I got another question asking if a member who is in a different aid category than the 3 we've been discussing, and it can't be changed by 619, will DMAS process an urgent coverage correction to ensure the cases transition correctly? That I am not sure about. I will say, if you do change some of these aid categories to accurately reflect the foster care specialty plan aid categories, as soon as it takes place, even if it's not by 7-1, as soon as the member is assigned into one of these 3 aid categories, that will trigger the assignment into Anthem. So that part is automatic. I'm going to have to ask those of you who are trying to do this quickly to reach out to our foster care inbox directly so that we can work with you to keep an eye on the aid category changes and to find out the answer to whether we have the resources internally to make these changes by 7-1. But again, it might just be another month of a delay until the member gets enrolled if you're changing the aid categories now. I hope that helps. And we have the foster care inbox information on this last slide that we're going to share. So I'm going to pass it to Anthem to see. I see some questions about justice involvement and some other provider questions that are coming next if you want to take a stab at those.
Sure. I saw there was an additional question about providers asking what happens if a provider is not accepting Anthem. And so initially we will have that standard continuity of care in place so that a member would be covered to continue with their provider. And then we'll be looking at that in care management and, reaching out to you to try and discuss those transitions. We also will be, looking at what providers are being used and comparing that to our network. And there may be opportunity to add providers based on what we see when we get all that data of who youth are using when they come in. then I think we have another question about transportation we can answer. And the question was, is transportation service available only for the child, or can it include parents as well? And so I do want to share it based on an individual situation, but when we're talking about youth, we can, of course, transport caregivers and parents as well to an appointment. Or if we need to coordinate, right, a youth may be coming from school to an appointment and the parent needs to be picked up at home so they can pick up the youth at school and get to that therapy appointment. We can work with those situations, and our care managers will be a great resource to discuss any questions like that about transportation. And then Maria, I know we got a great question. We love to talk about our judicial liaison. Do you want to share about that?
Sure. We do have a very experienced judicial liaison. She worked in the DJJ system, court system, as a PO, as a supervisor, and she also has a clinical background, mental health. So she really advocates for our youth that are in detention or have charges. She will assist our internal care managers in understanding what are the needs of that child. Are they incarcerated and they're about to discharge? Did they complete their treatment? She's very proficient, and she works alongside the state, the actual DMAS judicial point of contact as well, just advocating for the children to have what they need when they're getting out, and even if they just have charges, helping prep them and their case manager for the meetings that they're going to have, finding the right services. So she's really excellent. So if you have a youth that has charges and you want to consult with Katie, you absolutely can contact us. That is her role.
And Maria, I know you answered it in the chat, but just in case anyone has not seen that, there was a great question about, is the clothing value added benefit just on an emergency basis, or can it be used anytime?
Yeah, it can be requested once per year per child. So even if a foster parent has a sibling group of 3, they can request that for each child. That came from talking with foster parents and adoptive parents, and really understanding that it's hard to take in a sibling group or even a single child. And then they come with nothing often. And so this was a way that it doesn't have to be requested right at the time that a child is placed, but you're welcome to socialize that with the families, that it's available anytime. So once a year.
All right. I think a few more have come in that I can address. I'm seeing someone mentioned, and I'm curious about this, someone mentioned the Virginia Medicaid manual still indicates children who receive SSI should be enrolled as SSI. Will the guidance be updated or an update sent? We definitely are going to put something in writing because I know that just hearing it verbally in a webinar isn't so reassuring, but we do have guidance that even if a member receives SSI, if they're in foster care, they can be enrolled in the foster care or adoption assistance aid category. So I'm not sure the reference that the person who asked that question is referencing, but the one that we are referencing is our eligibility manual, chapter 3. There's a section that says children who receive SSI, foster care or adoption assistance, children who receive SSI meet the eligibility requirements for 4E foster care or adoption assistance. They cannot receive both SSI and 4E payments, so most of them elect to receive the higher SSI payments. These children are enrolled in Medicaid in the appropriate foster care or adoption assistance aid category. The aid category for individuals in the covered group of individuals under age 21 is 076 for a non-4E foster care child, 072 for a non-4E adoption assistance child. So that's in the non-4E foster care section. So yes, and we're already working with DSS to update the 4E manual that has information about this, but we'll take another look again at the Virginia Medicaid manual to make sure there's no contradictions there, and apologize for the confusion. I think this is a guidance that has changed in the last 10 years from what I've heard, but there's people who have been here a long time, and it can get confusing. Someone also asked, do we anticipate translating the FAQ slide into a written FAQ? Yes, we have actually a really long list of FAQs that we've compiled from everyone's registration questions, from the questions we've gotten here, even some questions we collected before we started rolling out these webinars. So we are collecting all of the thorough answers so that we have them for reference, but also we're going to be sharing kind of a more consolidated, frequently asked questions list from that we narrow down and simplify, that we're going to be able to share with our meeting materials. And we anticipate all of our meeting materials, including a recording and the FAQ, will be available before 7/1, but we'll definitely have the PowerPoint from today available to you all sooner than that. All members in Molina in Virginia will be transferred to Anthem on 7/1. Got that question as well. Are you guys seeing anything else, Anthem? Let me scroll through.
There was a question I saw that requested just clarification on fee for service means straight Medicaid. And then the question was, are you saying foster care and former foster care only at the options of foster care specialty plan or fee for service? And I think it would just be foster care would have that choice. Former foster care is a different choice.
Yes, and sorry, I'm not seeing that exact question, but yes, foster care 076 members in foster care will only have the option to opt out to fee for service. Former foster care and adoption assistance members will be able to opt out of Anthem and select a different MCO. I hope that clarifies.
Yes, I see one other question. Someone was saying that they need to schedule a psychological. Should they wait until 7/1 to schedule it, as that's when the child moves? I would say the Medicaid number is staying the same and it could be scheduled, but Christine, do you have any different thoughts? I mean, I understand that also sometimes can take a little while to get scheduled, but I wouldn't think workers would want to hold off on scheduling services.
Yeah, and I wouldn't encourage anyone to hold off on scheduling. I would, and Anthem, let me know if I'm wrong, I would encourage you to look for a provider that accepts Anthem. That might be easier when you're scheduling. But there's also going to be, so Anthem, if they do schedule something under, if they have Centera, they schedule something today for July 10th, and that provider doesn't take Anthem, but they've already scheduled it. So that's a real life example. So how would that
would there be an authorization?
Yeah, if it's already scheduled, I think it should fall under standard continuity of care. And if it's new psychological testing, I think typically the initial hours of psychological testing, I think the pre-op comes later. But if you have any situations like that, things that are scheduled and you're concerned that may create an issue, those are definitely the kind of things we want you to reach out to our support line and get connected with the care manager, because they can definitely help you navigate that. Because just as Christine and Maria said, we don't want anyone to be delaying getting the care that they need just because of this transition.
Yeah, and the current MCO covering the children now will be covering all services through 6 30 for phase 1 members. And so there won't be any lapse in coverage. It's just a matter of, whether the current MCO or Anthem, would be covering it. But I again, don't delay in scheduling an appointment. They did follow up and say the current insurance company is not covering a psychological. So in this, the person who asked this question, feel free also just to reach out to our foster care inbox, for unique or kind of case-by-case situations. We want to make sure we're offering the correct guidance. So I don't want to say too much more, but hopefully that's helpful. You all are welcome to reach out to DMAS before Anthem assignment with any questions like this. Anything else? I'm going to do one more scroll through. Did you all, Maria, you answered the milestones program answer in the chat. Did you all address it out loud? I actually don't know if everyone can see the answers in the chat or not. So I think maybe they can. You're on mute.
Sorry, I'm talking on mute. So there are multiple supports, whether it's that educational milestone program where, we could speak or advocate for attempt an override. There's also other support options. So we absolutely would ensure that that young person is feeling supported, whether it falls into the technical bucket of the educational milestone versus another funding source. We would make sure that young person is supported.
Awesome. I think that might do it for the questions, but again, as questions come up, please feel free to reach out. Of course, after 7-1, if you're in that phase 1 locality with your members, then Anthem provided their contact information. Otherwise, before 7-1, or really any time that you need something, please feel free to also reach out to the designated DMAS inbox for addressing and responding to inquiries and case management assistance. That's fostercare@dmas.virginia.gov. And that brings us to the end of today's webinar. Thank you all for taking the time to join us, for the thoughtful registration questions and questions during the meeting. And most of all, thank you for the work you do every day to support children and families. Like we've mentioned, a recording of this session, along with slides and follow-up resources, will be made available after today's webinar. And if you have any additional questions or need support, please don't hesitate to reach out using the inbox. Thank you again for being here, and take care. We'll see you all soon.